Is chronic pain getting you down? Well, stick around because in this episode of the Mental Health Toolbox, we're talking all about strategies to manage chronic pain with physical therapist and chronic pain coach, Pan Zhang. So let's go. Pan Zhang helps people with chronic pain find their pain-free path, guiding them through their biopsychosocial contributing factors to their pain. She is on a mission to help others get back to living their life, achieving their goals, and teaching you what is happening within, and to create and foster a supportive, positive, collaborative community to thrive in. Hey, are you getting value from this content? If so, be sure to subscribe to the MHT newsletter so that you stay up to date on all of the content as it's released and get access to the free toolbox of resources I have waiting for you there. You can subscribe using the link in the description to this episode. Hello, Pan, and welcome to the Mental Health Toolbox. Thank you so much for making time today. I'm so excited to dive into today's topic with your expertise being in physical therapy and chronic pain management. Perhaps we could start off. You tell us a little bit about yourself and what you're about.
Sure. So I've been a physical therapist since 2009. So is that 13 years, I guess, now at this point?
Wow.
Yeah. So I worked in an outpatient facility. So, your regular sprains, strains, you hurt your back, that's where you go kind of place. Mm-hmm. And I started off my career being very focused on hands-on, talking about your biomechanics, like, hey, your back hurts because you're slouching, that kind of thing. But kind of as I saw more and more patients into my career, I noticed that a lot of people were having pain that just, it wasn't going away, or people were coming in with pain that were, it was like 7 years of pain and they've gone to see everybody under the sun for their pain. Mm-hmm. And it just hadn't been helping. When you look at people like that, you're like, there has to be something just a little deeper underneath the surface there, right? So a few years ago, I started looking into the science of pain. And there's a huge movement now, actually, delving into that. And this past weekend, literally, I just got my fellowship of pain science. So it was like a 2-year program. And so learned so much. But yeah, I basically now what I'm doing is I am a chronic pain coach. So I help people with chronic pain. And stepping a little bit out of my physical therapy world, because the problem with people with chronic pain going through the regular medical mill or the medical model is that just they don't really get the attention that they need and the type of care that they need either. So kind of stepping out of my traditional PT world, I focus on like the holistic aspect of that person. And when I say holistic, it's not just like herbs and stuff, but really like looking at a patient's life and their environment and their circumstance and helping them through that in that realm.
Wow, that's fantastic. So you have 13 years under your belt as a physical therapist, right? You've been in the trenches, right? The day-to-day kind of seeing, I'm sure, a whole mixed bag of aches and pains and chronic issues. What did you feel, or what has been your experience in some of the challenges in traditional approach to pain management and access to care and managed care and all that?
Yeah. So, I mean, access to care is always an issue. Unfortunately, that's just one of the things that we deal with here.
Certainly is in mental health. I know that.
Yeah. Oh, yeah. Especially right now, there's such a huge shortage of mental health providers. But one of the biggest issues I had is all the clinics I've worked in, I've never been a part of like a big hospital system. So all the clinics I've worked in have been, private or privately owned clinics, which is fantastic. But to be able to communicate with that person's doctor, nutritionist, or even get them set up with nutrition, or if they need a mental health referral, trying to get them set up through that and communicating with every provider so that that person has one path that everybody's on board with. That was the biggest challenge, because so many times I would say something The doctor would say something completely different. And it's not their fault. It's just that's how they were taught and how they viewed the patient, right? And then they would go see another provider, whether it's a chiropractor, massage therapist, whatever. Everybody's giving this person all different types of messages. This person's in pain. They're stressed out. They're dealing with all sorts of stuff in life already. And now they can't even get a clear picture of what's going on. So I think that's one of the biggest issues with somebody who's been in chronic pain going through the regular medical mill. Yeah.
Wow. So do you feel then that by the time they would get to you, they've already seen X number of other specialists or doctors?
Yeah, totally. And another problem with that is that they're really disillusioned by the time they get to me, right? So they've seen their PCP, they've seen a rheumatologist, they've seen a physiatrist, which is like a pain specialist. They've seen potentially neurosurgery a lot of times. And the reason why they're here is either they've had surgery or they've been told that they're not a surgical candidate. And those are all really, really frustrating things. Again, it's just different messages. You go to a specialist and everybody specializes in their very specific niche, which is great. We need that, but nobody's looking at the whole picture.
So at what point did you say, I'm going to do something about this? Like, how did that transpire?
So this has been kind of building the last probably 2 years or so. And especially with with my pain science fellowship program, it's just been more and more apparent that being in the clinic, I don't know if you've ever had physical therapy, but a lot of clinics, just to be able to make ends meet because of, unfortunately, insurance companies and the government are actually paying physical therapists less every year for their services.
I did not know that.
Yeah. So our reimbursement rates are going down every year, which is insane to me. But
shouldn't it be the opposite?
Yeah. You would
Isn't
think.
preventative care like the whole,
the
whole thing?
Yep. Exactly.
Costs, on a macro scale.
Conservative care, like non-surgical care, right?
Yeah.
But no, Medicare just cut PT services by like 10%, like this year.
Wow.
They cut this year. Yeah. And then, insurance companies follow what Medicare does. So if Medicare is paying less, insurance companies are going to come and be like, actually, we don't want to pay that much. So this is what
that
you're
makes
getting.
sense. I never thought about it that way. They're kind of looking at them as a comp, right?
Exactly. So the side effect of that, or the result of that, is that as we're getting paid less for the clinic to be able to keep its doors open, that means we have to see more and more people on a given single day. So the problem that I've been seeing, and this has kind of been building honestly over the last probably 20 years or so, but really in the last few years, is that in the clinic, you have to see a patient every 20 to 30 minutes. And you just, as a PT who I want to see patients for 45 minutes to an hour, right? Sometimes more than that. If somebody's coming in, especially my chronic pain client, they're coming in crisis mode. Something horrible happened. They're having a ridiculously huge flare up. It almost killed them to get into the clinic. I can't help that person in 20 minutes.
And they come with a story too. I'm sure it's also therapeutic for them to be able to explain the history behind the pain without being rushed and getting right to, okay, come here, let me hurt you.
Yeah. Exactly.
Nice to meet you. You twist your arm. Yeah.
So it's getting harder and harder to treat people the way I want to treat them, in the way that I think is the most beneficial for them, because of all of these external factors. And again, this is not to vilify anybody, maybe except for the insurance companies, but we're all just kind of doing what we can. And clinics that have to increase productivity, they have to do it to keep their doors open. But because of that, and because of the trend, kind of stepping out, and the coaching is really what I'm going for now.
Wow. So what freedoms have you found in taking matters into your own hands through coaching? How has that differed from your previous experience?
Yeah. So with coaching, I get to spend time with a person. And we have, as a part of my coaching program, I have educational videos that people who go through my coaching program, they'll get like one topic a week. So they can go through that educational video on their own. And then we come together, we talk about it, implement it into their life. And that's been really, really beneficial, because I was, basically communicating that same thing to multiple people a day. But it's more efficient for that person, because they can, at the comfort of their own home, slow it down, rewind it, rewatch it if they don't understand something. And then we meet that week and we talk about it. And then they get to ask questions to me, versus me vomiting in the clinic information. Right. And they're like, "What's happened?"
Right. And they're drinking out of a fire hose. And then you want them to dive deep on it and find ways to life application. It sounds like what you've done is you've curated a lot of the foundational instruction that you would actually spend traditionally a lot of time educating them on. Now they come to you with already a reference point, a basis of understanding. So then you can say, all right, based on what you know now, this is what seems most applicable to you at this point of your life.
Correct. And with pain, the problem with pain is that nobody actually understands. Well, a lot of people don't understand what pain is. In fact, your doctor, like an MD, I think the most recent survey is that doctors get less than 1% of their curriculum is geared towards pain specifically. Like, yes, you go in and your knee hurts, but they're looking at your knee, not the pain, right? But you're there because it freaking hurts.
Right.
So it's an interesting thing. Like, just traditionally, we have never really looked at treating pain, but rather what causes the pain. The pain itself is a whole thing in and of itself.
Have you found that that's more, me not knowing anything really about pain management, do you feel like that's a cultural thing, like with the Western world, that we just look at kind of putting a Band-Aid on things and post care, or do you feel like it's kind of a global issue?
I think it's a global issue for sure. I think it's a little bit more prominent in Western cultures. A lot of the things that have traditionally been looked at to treat like pain, anxiety, stress, depression, things like that, come from a lot of the Eastern medicine. But as we're doing more and more research on some of these topics, we're seeing that, hey, this actually has some scientific basis for it, or there's actually research or evidence backing this technique up. The one thing that I can think of the most is just mindfulness and meditation. And this is something that's in your wheelhouse, right? Mindfulness and meditation, to be quite honest, like when I first started practicing like 13 years ago, if you had told me to treat my patients and tell them to meditate, I'd have been like, come on.
Woo-woo. Yeah.
It's not a thing. But in the last few years, it is blowing up. I mean, we've got apps that are geared towards that. And there's a reason for that. It's because they've actually shown that it really, really helps the mental health aspect, but also
all
the physical
money,
aspect.
Right? If it wasn't efficacious, then they wouldn't be pouring money into it.
Exactly. 100%.
Yeah.
So
true. Yeah. Mindfulness, meditation. Even in my experience in mental health, there's a lot of disconnect between our logical understanding or ideas, assumptions about what mindfulness is versus what it actually looks like in practice. How do you educate clients on the importance of mindfulness and how to actually practice that in their day-to-day life?
So for somebody to practice it in their day-to-day life, one of the big things with somebody with chronic pain, or if you've had pain for a long time, is that you've disassociated with your body because you don't want to pay attention, right? It's a protective mechanism that you've developed over time, because if you pay attention to your body, it hurts and you don't want to deal with it. You can't deal with it.
Makes so much sense.
Right? Over time though, your pain can change. And sometimes what happens is that you just have developed this barrier between what your brain's doing and what your body's doing, to the point where you just think, hey, that thing is that activity or that position is going to cause me pain. I'm not even going to do it. But it's so many times, if you just pay attention to your body and say, like, let me try it, let's actually pay attention and settle in and see what is actually happening here. For a lot of my patients, I'll say, like, well, when's the last time, let's say, you have back pain sitting for, I've had some patients that come in, they can't even sit for like 2 or 3 minutes. And they'll get up and preemptively walk it out, basically. And I'll say, like, well, next time you do that, let's sit. And I want you to tell me, and like, can you really hone in and focus on what are you feeling there? And it's funny, most of the time, what they describe to me is actually the anxiety to the pain, before the pain. So they're like, oh, I have to get up because I feel like it's like starting to come on. I'm like, what are you starting to feel? It's like, it's just tight and it's like pressure. I'm like, is it painful? And like, they're like, well, no, it's not painful. I'm like, okay, let's kind of just sit with that a little bit more and just connect with that. And because your brain's built to protect you, right? So if your brain repeated this pattern so many times, and every time you've had pain, your brain automatically, after a certain number of repetition, is going to say, like, don't do that anymore. And then 10 years later, you still can't sit for 3 minutes at a time.
Oh, that makes a whole lot of sense.
Yeah.
Right. Our brain trying to protect ourselves or learn. In mental health, sometimes we talk about what fires together, wires together. And if we teach our mind avoidance to particular triggers or things that make us uneasy, uncomfortable, anxious, then eventually we've taught our brain, whether you want, through dendrites or however you want to frame it, that this is the preferred path. And if we try and force it into a different path than what it's used to, then it will fight us. Right.
Yep.
And that can come out in somatic forms, right? And via pain or other, right?
100%. Yeah, we use that phrase as well. If when it fires together, wires together. I'm a very visual person, so I use the analogy of, like, it's like a wagon wheel, just going over a rut, and that rut gets deeper and deeper and deeper every time. And now when you try to change directions or you try to go off trail, it's super hard to do it. But if you keep doing it, it gets easier every single time.
Excellent. I use the analogy of like a trail in the forest, right? If you see a beaten path, you're going to take it. And yeah, it's a lot of work to create a new path, but over time, right, through repetition, and you cut down the bushes and hack your way through it, it gets easier and easier. Right. And then it's indistinguishable sometimes from the other path. It's a lot less resistance to change. And that's hard though, but behavior change is so hard, especially when pain is involved. Right. So how do you get around that? What kind of, when you have these talks, what kind of objections do you get from your clients?
So fear is the biggest thing, right? That my clients have to deal with. It's because they've been dealing with this for so long, and they know when it's, when they have a flare up, sometimes it knocks them on their asses for like a week or two, and they can't do anything. And I get it. And it sucks. One of the things that I find that my clients do the most is that when they feel good, they are like, I'm just going to live my life as normally as I can. Unfortunately, what happens after they do that is that they tank. So that's all that the boom bust cycle. So
I like that boom bust.
Yeah. So you're like kind of not feeling great. And like one day you're like, oh man, I feel really good. I'm going to clean the whole house. And you do all of this activity. And the next day, or maybe the day after, sometimes your body's like, what just happened? And then that protection mechanism kicks in again, right? And it's not a bad thing. Again, your brain and your body ultimately is trying to protect itself from harm. But you're introducing this big new thing. What happens is you go through the bust. So one of the big things that I tell people is, on good days, I know it's going to be hard to hold yourself back, but just try it the next time. Don't clean your whole house, clean one room, and then see how you feel the next day. And it's basically, you don't go through the boom bust cycle. You might have a little, I don't know, hill that you start cresting, but that flare up is maybe half a day or a day versus a 2-week flare up. And then you're like, oh, okay, I'm back to my baseline. Maybe I can do a little bit more. Okay, now clean the next room. So really pacing is a big thing that I talk to my clients about. And that's where that, unique program comes in. Is one, you have to figure out what drives that person, what's driving you, what kind of activities do you want to get back into? And then two, what speed do you think you want to get back into it? Like everybody's pacing is different, right? So somebody can sit for 2 or 3 minutes at a time. I have them start trying to sit for, okay, try another 30 seconds and see how that goes, and then get up. Versus, somebody who's had pain, but they can run like 2 miles and just can't get over that 2-mile mark without pain. Okay, go for 1.25 miles or something like that. And it's really just tailored to that person.
Yeah, it sounds a whole lot like goal pacing we talk about in mental health and anxiety and habituation, exposure therapy, right? Consistency being king and taking small bites, not biting off more than you can chew. Very similar, right? With pain management, it sounds like.
Yep, it's 100%. I mean, one of the biggest things that I've learned through delving into pain science is that it's much more of a mental thing than it is a physical thing. But you have to work both sides, right? I think historically, as a PT, I'm used to working from like the head down. And, like I can do everything here. And then therapists I think historically work from the head up. I actually had a patient a few years ago who was a therapist, and he was, I think he specialized in like depression and anxiety. And he's like, it's interesting. As I learn more and more about this, we've found that the body affects the brain. And as a PT, as we dive more and more into this, we found that the brain affects the body. It's kind of like, oh, maybe
it's like
we're
a feedback loop. Yeah.
Maybe it's all one system, actually.
Yes.
Yeah.
Yes. Yeah. So what have you learned about depression and the role of chronic pain, and how do you address that as a coach when you're talking with clients, and what have you found to be true?
So first of all, with clinical depression, I always make sure that they have a therapist or a counselor or somebody that they're seeing on the side, because I'm not trained to help somebody with clinical depression. The things that we're doing will help them through that, but ultimately they need somebody like you, right? They need more professional help. So that's first and foremost. But depression and chronic pain are like best buddies. And it's kind of a chicken or the egg question. We're not really sure, and the reason is unclear as to, does depression comes first or does chronic pain come first? I think it's a little bit of everything, right? It's
a messy science.
Yeah, exactly. But if a lot of the tools that I use to help people with chronic pain is addressing so much of their mental health and awareness and mindfulness as well, that it can be used in potentially, I don't know, you'll have to tell me if it's a part of like the depression toolbox as well. So some of the things that I make sure my clients, almost every single one of my clients, do is just a gratitude journal or a gratitude practice, whatever that might look like for them. Whether it is journaling or it's just, at dinner time, you're talking about what you're grateful for with your family or with your kids or your partner or whatever. That's enough too. Some people hate journaling and like cringe at the thought of journaling. Just talk it out. That's fine. As long as you're mindful of what you can be grateful for that day. That's the point of the practice. And then journaling in itself, for sure.
Absolutely. I know I personally struggle with chronic headaches, and I have since I was a teenager. And when I check in with my primary doctor, she's a DO, right? So she's always like, so how are things going at home? Like you said. And so I've been paying more attention to that. And I definitely noticed that when I feel like I have if I'm very busy and then I have like an unanticipated stressor, and I just feel like I can feel it in my body when I'm containing a lot and I don't express things, or I don't attend to it, or I don't have some breathing space, or I don't stop and do some deep breathing and the things I teach, practice what I preach. And I try to be pretty good about those things, but I've noticed that if I don't take that break, if I don't like get that power nap or go sit on the porch and sip on my coffee and look at the flowers, pet my dog, then it'll almost always show up toward the end of the day. It's almost like a compounded effect, right? Headache will hit me like, like a ton of bricks out of nowhere, and the back pain and the whole bit. And sure, part of that's probably getting up, but a lot of it I feel like is creating that space to really decompress.
Yeah. So it's interesting that you bring that up. So over the weekend, when I was doing my fellowship graduation course, one of the discussions was holding space for yourself. And that's something I've never really thought of before. And especially with the last 2 years with the pandemic and everything, everybody focuses on the negative impacts. But at the beginning of the pandemic, when everything shut down, all healthcare and everything shut down too, I actually took about a month and a half off. That is the longest I have ever not worked in my entire life since I started working at like high school and like after I graduated high school, right? And at that, like the first week or two, I was so anxious. Like I didn't know what to do with myself. I kept checking my work email, although nobody was like there. What's happening with the outside world? But after I got over that hump, it was kind of amazing. And it was the first time, and looking back on it now, I'm like, that was the first time I've had in, at least throughout my career time, at least 13 years, where I've had time to hold space for myself and just be, and just let yourself do the things that you always want to do, but never have time to do. So at the time I didn't have, it was just me and my husband at the time, and didn't have a whole lot of like extra family stuff. But so people with families and things like that, it's even more so, right? Like you're just rushing around all day long.
Oh, kids are a whole other dynamic, let me tell you.
Yeah, exactly. I just found that out. My daughter is 2.5 months old. So that is,
oh, wow.
That is
I'm glad I'm not you. No, I've been there. It's quite a phase of life to be in.
Yeah.
Just hold on. Yeah. Weather the storm. Get some sleep when you can. Yeah.
Yep. Definitely. But yeah, I mean, just giving yourself space is so important. And so many of my clients with chronic pain, they don't know how to do that. They don't feel supported enough to do that. And that's those are individual struggles that we kind of tackle. And honestly, if you can get 30 seconds a day where you can just give yourself space and give yourself grace, sometimes that's where you have to start. And everybody has 30 seconds a day, right?
Absolutely. And I think, taking a strength-based perspective, right? And reminding people, it's to let go of some of their assumptions about what the expectations are and what they give themselves permission to do. Like you can give yourself permission to get up half an hour early and, have some time to reflect without your, any demands on you, right? You can give yourself permission to lay down for 10 minutes, in the afternoon if you need to, right?
Mm-hmm. Yeah. And honestly, even just if you have a commute to and from work, just being in the car, as long as, you don't have road rage or anything, just being in the car and just letting that be your time. That's what I tell a lot of my clients, because honestly, that's what I do. I turn off the radio, it's completely silent in the car, and I let myself just sit in silence. And it's the most glorious thing.
Oh, absolutely. A lot of people know me as being a podcast addict. Like I always have a podcast in my ear, whether I'm gardening or watering the grass, doing yard work, doing the laundry. But when I'm driving, I love listening to my podcasts. But after work, oftentimes I'll just turn it off, roll down the windows, take the slow way home, just a couple extra minutes because I don't live that far, and then just be, right? Mm-hmm. Just be. Yeah. Yep. Just be. I'll turn my phone on, I turn my phone on do not disturb at night. And then in the morning I have, give myself a little time before I turn it off. I won't even look at my phone. This is more a recent practice just because I have the habit of like, ooh, what notifications do I have in the morning, but that puts into an immediate state of alertness and hypervigilance. And feeling like I'm quote on, right? And so by not allowing myself to look at my watch or my phone until I've had at least one cup of coffee, and like I said, have 5 minutes to pet my dog on the porch, then that gives me a little bit of time to kind of bookend my days that way.
Yep.
Yeah.
Definitely. Yeah. I mean, ultimately our phones and our technology is a type of addiction, right? So if every night you're almost detoxing from that. And if you can't hold off on starting that the next morning, it actually really helps. So my husband, before I met my husband, we've been married for about 6 years, 7 years, I don't even know. But before I met him, I was like sit in bed, scroll on the phone kind of person. And it started to take a toll on me. And then he made me, it was a fight. Like he was like, we don't do phones in the bedroom. Like this is not happening anymore. And I'm like, I can't, I need it for my alarm, like coming up with all these dumb excuses. He's like, we'll get the alarm
objections, protest behavior.
Exactly. It's like you don't want to admit that you're kind of addicted, but you actually are. But honestly, like it helps me sleep better. And when I wake up in the morning, I can't just roll over and like pick up my phone and doom scroll for an hour and being like, oh no, what happened to my day? Right. And it just makes you feel a little bit more productive, makes you feel a little bit more springy. I don't know, for lack of a better word. That's how I describe my feeling.
So glad you're transparent about that, because some people are like, oh, I just decided to do this thing after 10 years of developing this habit. No, it's hardly ever that easy to change our behavior. Usually it takes an outside person who loves us enough to challenge us to change our behavior, whether that's a practitioner like you or a spouse, right? To call us out on that stuff and to challenge our protests, right?
Yep. Because you can make all the excuses in your head. And that's, I mean, with my clients with chronic pain, a lot of it is lifestyle changes they have to get through, right? So I'm there to kind of help them hold them accountable a little bit. But also one of the big things that I focus on with my clients is, and this is actually something that I request that they have before we start. And if they don't have a clear understanding, I don't sign them up for a coaching package, is that I want them to have a clear why, whether that is just, I feel I want to feel a certain way, or I want to do this for my children, or I want to do this for my husband or something. Even if it's an external locus of why, that's fine. But it's not just, I want to be pain-free.
So powerful, having a why, right? Yeah. So absolutely. So, I mean, figuring out what you're working with, right? In the front end, and before they even come to you, that's the homework you give. You give them the assignments. So they say, look, this is what I'm working with. There's some insight there. There's some explorative work they've already done. And then having that why, right? If we have a big enough why, we can walk over hot coals, right?
Yeah.
But without it, it's kind of like, what's the purpose, right? Eventually, that motivational triad, pain, convenience, and what's the third one? Pain, convenience, and
I'm not sure.
Reward, I believe it is. But yeah, definitely. If we have a big enough why, then we can find the gumption to change, right? To get over our excuses, right? To be uncomfortable long enough to get something bigger, right? A big enough reward.
Totally.
Yeah. And oftentimes that is family, or it's health, or it's to give back. Everybody has a reason somewhere, right? Sometimes you have to dig a little bit deeper, right? Depending on the discomfort. What are some common whys that you found in your practice and dealing with people? Is there any kind of theme that you found?
I find family is a big one for sure. For some of my older clients, it's, I want to be able to keep up with my grandkids. I want to be an active part in their life. I have people coming in and they're like, I can't even hold my grandchild for than 2 or 3 minutes at a time. Or like, I can't play with them because I can't get down on the floor. If I try to, I can't move for a week afterwards, something like that. So I think definitely that external why for them is very, very important. For somebody who maybe doesn't have a lot of family or what have you, but they have like this drive some days maybe that they're like, I'm just sick of this. I would encourage those people to think about, what does your best self look like? And pretend like that is somebody else. Like pretend like that's not even you. Just think about, what does your best self look like? And that's not like physically what you physically would look like, although that could be part of the picture. But what is your best self doing? Are they working? Do they have their own company? Are they are they an artist? Like, what is that person doing? And why can't you be that person yet? And then that is the why. And then the why can't you be that person yet? Those are the barriers that we address in our program, right? And sometimes if you think of this person as somebody who's not you, because it's really hard to do something for yourself. It's
Isn't
weird,
it? Why
right?
is that?
Yeah, you're like the last person you're going to try to do things for, right? But if you think about this ideal you as somebody else, maybe like that is your new best friend, do it for them, then that seems to help them out quite a bit.
Absolute objectivity.
Yeah.
Objectivity. It's a hard thing, to step outside of ourselves, mentally speaking. Absolutely.
Yeah.
I guess that's where the coaching comes in.
Yep. And like the accountability and everything, that's the key for sure.
So where do you see your practice taking you next? You've gone from private practice to holistic coach on around chronic pain. Where do you see your vision taking you?
So right now I'm focusing on individual one-on-one coaching. I would love to create a community of people that are that are at different stages of their journey, whether you're just starting out and wanting to figure out what your why is, or if you a year ago woke up and was like, oh, I haven't had pain in 6 months, or if you're at that point, but you've been on this journey, just a group of people who can help each other, guide them through, see that there is a light at the end of the tunnel, that people have done this. And I'd love to be able to create that. It's a part of my kind of market research. I was in a lot of, forums online for people with chronic pain, and there's just no guidance. And that's another reason why I really want to do the coaching, is that people are saying, I went to my doctor, I got no answers, got more questions, and I'm even more anxious now. That's not how it's supposed to work, right? And it's not their fault at all. It's just the system is not built for them.
Right. So community, right? And being able to learn from each other, right? You see that a lot with other categories of wellness, mental health, right? You see a lot of groups, whether it be on Facebook or otherwise, for things like anxiety, depression. You see that in financial wellness groups, and you see that in business groups. But come to think of it, I haven't seen one for pain. You see it for weight loss, you see it for other things, but having that sense of camaraderie with the common goal of pain management, there doesn't sound like there's a whole lot of community support, right, to lean in on. And when you don't see that as a possibility, right, with other people, if you don't see the social proof, then it can sometimes feel like a pipe dream, I imagine.
Right. Totally, 100%. And I think the key there is that it has to be positive community. There are plenty of forums where it's just kind of a bitch session for, and there's no positivity in there. And there's actually nothing that they can take away to implement for their own lives. So that's the key, is making sure that, yes, it's a community. People can help each other. People can air grievances, because everybody needs somebody to talk to. But at the end of the day, it has to be a net positive effect.
Wow. Yeah, makes sense. Have you noticed across your practice that there are particular coping skills for pain that are more effective than others?
So I'm biased, obviously, in the type of coping skills that I treat, or that I provide or help people with, in that, breathing, mindfulness, light exercise to what you can tolerate. Those are really the big ones that most people need to do at differing levels to help with their pain and also with their mental health, because it really is, you can't separate it. If you have chronic pain, there's something else going on there too. A lot of people rely on what I call passive coping strategies. Passive doesn't mean that it's bad. It's just that you're not actively doing anything. It's not a bad thing. There's definitely benefit with passive coping strategies. But those are like the ice, heat, stim, the rubs, like the CBD rubs and things like that. And those are good to help you, if you know something works, to help you get out of flare up or something like that. But they're not long-term strategies. Those are not the things that are going to get you from point A to point B. Those are the things that are going to just kind of keep you oscillating right around point A, if that makes any sense.
It makes perfect sense. Like, I mean, I think I alluded, I not only have chronic like headache issues, but I have lower back pain issues. And sometimes if I do too much in the yard, like I did this weekend, trying to go toe to toe with the Matilla bush that took over the backyard, or digging up the grass for a butterfly garden over the pandemic. That's our pandemic project. Save the butterflies, dig up some grass. But then I'm wearing one of those heat thermal packs on my back for 3 days straight, and that's it's like it hurts for me to walk sometimes, and usually I resort to heat. But I found that if I do 15 minutes of walking every day or twice a day, for a week, that does far better for me than laying there with a heat pack. Is my only resort. So
yeah. And that it's not a either or, it's an and. Like, you can do the heat pack or 15 minutes a day, right? And the heat pack, like I said, it has its place. Like, it's going to help get you through the day, and that's really, really, really important to do. But the next time you go try to dig out another butterfly garden, you're probably going to be in the exact same spot, right? Heat pack on your back for 3 days. Versus if you consistently walk 15 minutes a day for, I don't know, a couple months, next time you try to do really, really strenuous yard work, you might be like, oh, well, I don't actually have to sit. Yeah, it's like, I
should be sore right now. No. But going back to what you said, that's the pacing up to, right? Versus like just rest, eat an elephant, right?
Yes. Eat an elephant. I like that. That's
or
great.
starve, eat an elephant, right? Yeah. Better to do a little bit over a course of time to build up to those bigger things, right?
Yeah, 100%.
Excellent. So where should we send the audience to learn more about you and what you're doing?
Yeah. So if your audience is interested in learning more, I have a website. It's painreliefpath.com. I also have an Instagram and a Facebook group that I don't really understand Facebook groups. I think I set it up wrong. So there's like nobody in there. But if you want to try to find
it's
it's there.
To me, Facebook.
But my Instagram is pain relief path. There's it's pain _path_ pain _relief _path, and Facebook is the same thing. So those are the biggest places to find more information. I'm most active on Instagram. I love doing posts and silly videos and things like that.
Oh, fun. Excellent. I prefer Instagram too.
I don't dance, but I like silly videos.
Excellent. So I'll put all that up, of course, on the lower thirds once this is edited, and then in the description as well for any of you out there who want to learn more about managing chronic pain. And I know a lot of you in the audience do struggle with chronic pain. So it sounds like a great resource, and I really appreciate your time. Is there any other nuggets of wisdom you'd like to impart before we say goodbye?
I think the biggest thing, if you're dealing with chronic pain, is that don't be too hard on yourself, And one of the biggest things that most people lose sight of is that you can get better. Your body and your brain, one of the main mechanisms is to heal. Like, I have a lot of chronic pain patients that are like, I'm still like, something went wrong with the healing process because it still hurts. And I injured myself 3 years ago. Right. And tissue wise, you're most likely already healed, but there's potentially some deeper healing that needs to happen underneath the tissue level. But it is possible, and it is very, very possible if you let it. And it's really just letting it happen, putting aside a lot of your fears and anxieties and worries about, what if this doesn't work? What if I do this again and it flares me up? A lot of times you just kind of have to surrender and kind of go for the ride. But just remember, your body is built to heal. I've never met anybody yet who can't heal, and you can do it. So,
wow, I love that. Their body is built to heal. I love that.
Yep.
Yeah. Excellent.
Yeah.
Well, thank you so much, Pan, for taking the time to kind of share your nuggets of wisdom with the audience, and really appreciate you being here. Would it be okay if I invite you back on down the road?
Of course. I'd love it. Yeah.
All right. Well, I really appreciate it. And you enjoy the rest of your week, and take care. And I'm going to start putting some of these things to practice ASAP.
Let me know if you have any questions.
I will. Thank you so much.
Your butterfly garden.
Yes. No more digging up grass.
Okay. Bye.
Bye. Well, there you have it. Another tool to help you thrive. Hey, if you're getting value from this content, be sure to like, subscribe, and share if you haven't done so already. It helps raise mental health awareness and grow this channel. And while you're at it, if you're listening to this on the Apple Podcasts, it would mean the world to me if you left a review. That also helps reach more people. All right, so until next time, keep thriving. Take care. Bye-bye.